So I met a 35-year-old man who came to my consulting room one day. And he had symptoms that suggested he has diabetes, 35 years. He wasn't aware he has diabetes. And I made him do a test, the fasting blood sugar. The sugar levels were very abnormal. And the other labs he did indicated that he has started developing severe kidney failure. And then he's losing his vision to diabetes. This gentleman died about 5 years after I have diagnosed him with diabetes due to the complications of diabetes. And he died when he was 39 years from chronic kidney failure. So diabetes is a very serious condition, and I can't agree more with the theme for this year's celebration, the family and diabetes. I think today's World Diabetes Day draws attention to the issue of paramount importance to the diabetes world, particularly relating to diabetes in a family context. Diabetes affects individuals who belong to families, and the impact of diabetes on the family and the patient support systems, as well as the role in care and support, cannot be overemphasized. And we are celebrating today seeking to promote the role of the family in the management, care, and prevention of diabetes. We know that about 4 in 5 parents would have trouble recognizing the warning signs of diabetes. We also know that 1 in 3 persons wouldn't know the warning signs at all. And then we know that 1 in 2 persons currently living with diabetes, particularly type 2 diabetes, are undiagnosed. And that leaves them untreated, unmanaged, and that can lead to life-threatening complications. These complications include blindness, amputations, kidney failure, like I mentioned in my story, heart attacks, and strokes. It is estimated that about 4 million people died in 2017 alone from diabetes. And then in Central Region, diabetes and its complications currently accounts for about 2% of all our total OPD attendance in our health facilities. And several studies have estimated a prevalence between 6 to 8% among our general population in Central Region alone. Females are highly affected than males, and the existing resources and professional staff available for the management of diabetes are inadequate within our communities and districts. The significant risk factors associated with diabetes are a family history. Somebody in your family must have diabetes, occasionally before you can get it. If you eat poorly and unhealthy diet, you also are at risk of getting diabetes. Physical inactivity and not exercising and not walking enough can also predispose you to getting diabetes. Overweight and obesity, which in Ghana has become a sign of good living, also predisposes to diabetes. Alcohol and tobacco use, inadequate rest and relaxation among our population. And now, if you are any age above 30 years, you also stand at risk of getting diabetes if you are a black person. Some of these same risk factors account for other diseases, such as hypertension, high fat levels in your blood, cancers, and heart attacks. And this is a worrying problem in Ghana and in Central region in particular. I think we all know the warning signs of diabetes. But for the purposes of our education this morning, I would like to go over them. If you have diabetes, you have excessive hunger, and you feel like eating all the time. You thirst excessively, and you would want to drink water and fluids all the time. You drink more frequently than the normal person or than normal. You can either lose weight or you can gain weight. You get tired easily, even when you haven't overburdened yourself. You would have visual problems. You have numbness in your feet and your arms. And sometimes you can have wounds that will take a long time to heal. These are the warning signs of diabetes. And this is what our people need to know about the disease. Families need to know it, parents need to know it, so that they can pick these warning signs on time, so they can go screening. But the good news about diabetes is that we can do something about it. We can prevent diabetes and its complications with simple lifestyle changes. Many times these are not difficult to do. It's simply eating more vegetables and fruits. Choose to drink more water and tea rather than carbonated drinks, Coke, Sprite, and fruit juices. Reducing the intake of sugars and sweets. Reducing the intake of salt and fatty foods, fried rice, fried chicken, and everything fried. Avoiding eating late after 7 or 8 p.m. Increasing your daily time for walking and exercising. And then reducing your intake of carbohydrates and getting adequate rest and relaxation. These are simple measures we can all adopt in our life to prevent diabetes and its complications. To help address the challenge of diabetes in Central Region, we in the Ghana Health Service will continue to highlight the roles families and support networks can play in adopting healthy lifestyles. We will continue to promote awareness on diabetes and its complications within our communities and districts. We will work to scale up medical screening for diabetes for individuals and their families in our various communities. We will establish clinics, or we will continue to establish clinics and establish multidisciplinary teams to care and manage for diabetes, persons with diabetes and its complications. And then we will continue to work with and count on the support of all our relevant stakeholders. The district assemblies have a role to play. Religious bodies, our clergy, and then our Muslim brothers. Our chiefs and queen mothers have a role to play. Civil society and non-governmental agencies, the media, and the private sector. And I'm glad about what East Cantonment Pharmacy and Local-Aid are doing today in supporting the program today. So we'll continue to count on your support to scale up promoting and preventive interventions, screening, treatment, and care for persons with diabetes.
Diabetes is a problem worldwide now. I'm not going to go through the statistics because everybody that came in has spoken about the statistics. Unfortunately, what I saw was everybody that came is talking about food, lifestyle, and what type. Nobody is talking for the type 1 diabetics. They didn't have any lifestyle condition. My earliest memory living with diabetes is as low as 5-6 years, where my nursery teacher came to my parents that I'm snobbish, I don't want to play. I was withdrawn. At the same time, if we were playing together, I could see at my age my colleagues can bath themselves, but I can't. And it continued. When we go to Tema General Hospital, I still remember I have to go and lie in bed. And I was a regular person there before my mother would go and do all the paperwork. The long and short is, the doctor told my father, this one, you don't give them attention. Watch around 18 years. So I saw my father's love redrawing. At a point, I had to be left in Ghana and the family go away because it was like I was a big burden. So my grandmother, may she rest in peace, is the reason why I'm standing here. I say, "Be one fan of mine. No shop or school nibi." 5 years ago, I went for a meeting in Dubai. I met this doctor. I said, "Do I know you?" I ignored her. I was saving her the problem. She came again. "Do I know you?" I said, "Yes. You are the one who said I would die at 18 years. And I'm still there. I'm there because I had proper family relationships, good nurses. I wrote my O-level in hospital bed, my A-level in hospital bed. And when I came out, I decided I'm going to give back to the community. Went to the medical school one semester, redrew, and went back into nursing. Diabetes is not all about lifestyle. We always forget the type 1s who did not call for it, who did not eat what they were not supposed to eat, but who were just born with the condition. So I'm reminding everybody, diabetes is not only about lifestyle, but there are some of us too who did not call for it. As we continue, in Africa, Nigeria used to have the highest rate of diabetics in Africa, but they were toppled in 2018. Unfortunately, Ghana is happily on the 5th place in Africa. Yet, we still don't have solutions. They are saying now that if somebody from South Africa is diagnosed with diabetes, the person has a life expectancy of 22 years after. It comes down to Tanzania, where if somebody is diagnosed, the person will live about 18 or 17 years. What is our life expectancy in Ghana, where insulin is not available, strips are not available, lancets are not available, and even the technical know-how of the nurse breaking the finger is even not available. Diabetes, it hurts that we have to wait for a year before there is a DEBA, because 3 out of every Ghanaians now is living with diabetes. Last year alone, they admitted 37,000 people nationwide, according to the district health management systems of diabetes. Those were the ones we saw. Unfortunately, in Ghana, 90% of diabetics are only found at postmortem. Most of them are wrongly diagnosed with malaria, typhoid, and in the long run, they perish at postmortem, then cause of death becomes diabetes. Diabetes is a life-threatening condition now. Many indigenous communities are genetically predisposed. 20, 30 years ago, we used to say it's a rich man's disease, but now our highest statistics are coming from Volta North, Tamale, Upper West. Are they also the rich in society? So we need to have a proper look at diabetes, do good research, and find out what exactly is going on. We have to look at access to appropriate medication and care for diabetes to be seen as a right and not a privilege. 80% of people living with diabetes pay for their health care in Ghana. And not even Ghana alone, Africa. As I said earlier on, a person in Zambia who requires insulin for survival has only a life expectancy of 11 years. A person in Mali who is in West Africa has 30 months to survive. Have we researched Ghana and seen how many people are dying as a result of diabetes? Diabetes needs to be given equal attention to HIV. Diabetes is increasingly affecting the economy even of Ghana. In developing countries, the most affected are between 35 and 64 years. Those are the breadwinners of the family. In 2017, we had 34,000 amputations in Ghana as a result of diabetes. Unfortunately, my country, Ghana, does not even have one foot care center. If 34,000 people are having amputation, and we have 10 people that they are leaning on, it means 34,000 by 10 are the people affected with diabetes. That's the theme. The family and diabetes is not out of question at all. It's the right thing, because diabetes is affecting a lot of people in Ghana. Diabetes can be controlled. It's not a death sentence. People living with diabetes, if they get good medical care, appropriate medication, eat well, exercise well, and good education, we will live long with diabetes. And forget about the statistics Obroni is putting down for us. Now, our major problem, Mr. Deputy Minister, we writing a resolution, advertisements, where every herbal medication treats diabetes. Please, can the Ministry of Health look into it so that they stop those advertisements, because those advertisements are adding insult to injury. The second thing is training of nurses as diabetes educators. Nurses are not willing to go into diabetes education because they don't get incentives. At least, we suggested something that is affecting almost a quarter of the country. If we could have basic diabetes education as part of the curriculum in nursing training colleges. We need emphasis on foot care, and at least one foot care center in Ghana. I thought the Minister of Social Welfare was going to be here. A lot of people are disabled with diabetes. We will have to look at getting disability grants and even getting handiwork for those who have been amputated. There is a lot we want to say, but we won't stand on this platform. We will plead for audience, because the diabetics are getting agitated nationwide. Being quiet doesn't mean we can't fight. We can push back. But just that we want dialogue. We don't want it to be today. We want the finger pricks to go on. We want people with diabetes to have proper quality medication. And we want food care centers in Ghana to save our legs. Thank you very much.
Thank you very much. It's not only diabetes. The ministry is actually doing a review of the package that must be given under the National Health Insurance Scheme. They are actually considering diabetes and other diseases too. So for now, I would not specifically say that it is going to be included or not, because in doing that, you also have to look at the profile of amount of money that would go into it, because we have to know that we have to service all these with the amount that we derive from the National Health Insurance. And so we are looking at all these things side by side to see whether it will be sustainable to include this. But there's a lot of talk in making sure that we include some of these diseases, because the effect it has on families is so grave that once you are a poor person and, for instance, you are diagnosed of diabetes, it's just like your death sentence. So the ministry is considering that and other diseases too, but I cannot state emphatically that we are going to include that. Yes, this is about management. It's about management. I think that we would engage the Food and Drugs Authority more closely on that issue, because I'm very confident in them, because with the little that I know that about our Food and Drugs Authority, it's one of the best that you can talk about in Africa. And so for them to give, let's say, a pass to those kind of advertisements, I'm sure they would have done their checks. But that doesn't preclude us from engaging them more on this, especially when we know that when you get the disease, you only have to manage it and not necessarily cure it completely. So we engage the Food and Drugs Authority on that one.